Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a neurologist talking to a patient called Mr. Allen. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Allen. I see you've been referred to me by your GP. How are you feeling today?
Good afternoon, Doctor. Well, to be honest, I'm feeling a bit anxious. The GP mentioned something about a possible meningioma, and I've been trying not to panic.
That's completely understandable. Let me reassure you right away that meningiomas are often benign, meaning they're not cancerous. But before we get ahead of ourselves, let's go over your symptoms and history in detail. Could you start by telling me what's been bothering you?
Sure. It started a few months ago, really. I began getting these headaches that seemed different from what I'd had before. They're not sharp pains exactly, more like a constant pressure, especially in the mornings.
I see. And have you noticed any other symptoms? For example, changes in vision, balance, or memory?
Yes, actually. My vision's been a bit blurry now and then, and sometimes I see double, especially if I'm reading or using my computer for too long. My wife also noticed that I've been a bit unsteady on my feet. A few weeks ago, I stumbled while walking down the stairs, which really scared me.
That does sound concerning. What about your memory or concentration? Any changes there?
It's funny you should ask. I've been forgetting small things, like where I've left my keys or what I walked into a room for. And, at work, I sometimes lose my train of thought mid-conversation, which is embarrassing.
I can understand how frustrating that must be. Have you experienced any numbness or weakness, perhaps in your arms or legs?
Actually, yes. My right hand feels weaker than it used to, and sometimes I get this tingling sensation that comes and goes.
Thank you for sharing all of that. It gives me a clearer picture of what might be going on. Now, just to confirm, do you have any history of head injuries or family history of brain tumours?
Not that I know of. I've never had a head injury, and as far as I know, no one in my family has had anything like this.
All right. That's helpful to know. Let's talk about the next steps. Based on your symptoms and the initial findings from your GPA meningioma is a possibility. These are tumours that arise from the meninges, the protective layers covering the brain and spinal cord. While the word tumour sounds alarming, I want to emphasize that most meningiomas grow very slowly and are benign.
That's a bit of a relief. But how do we know for sure?
To confirm the diagnosis, I'll recommend an MRI scan. This will give us a detailed image of your brain and help us see if there's a tumour, where it's located, and how large it might be. Depending on what we find, additional tests, like a CT scan or biopsy, might be necessary, but the MRI is the first step.
Okay. What happens if it turns out to be a meningioma?
Treatment depends on a few factors, such as the size and location of the tumour, how quickly it's growing, and whether it's causing significant symptoms. If it's small and not pressing on vital areas, we might just monitor it with regular scans. On the other hand, If it's causing symptoms like yours, surgery to remove it is often the best option.
Surgery? That sounds serious.
I understand it might sound daunting, but the good news is that meningiomas are often well-defined and easier to remove than other types of brain tumours. Neurosurgeons are highly skilled at this, and the success rate is very high. For some cases, if surgery isn't suitable, we can also use radiation therapy to shrink the tumour.
I see. And what about the risks?
That's a good question. As with any procedure, there are risks, such as infection or bleeding, but these are relatively rare. The specific risks depend on the tumour's location. For example, if it's near areas that control speech or movement, we take extra precautions to minimise any impact.
That's reassuring. Is there anything I should be doing in the meantime?
For now, focus on managing your symptoms. If the headaches are persistent, over-the-counter pain relief might help, but avoid anything stronger unless prescribed. Stay hydrated and try to reduce stress. It can exacerbate symptoms like headaches. And if you notice any sudden changes, such as worsening vision or severe weakness, contact us immediately.
All right. Is this related to anything I've done? I mean, could I have prevented this?
No, there's no specific cause for meningiomas that we know of, although they are slightly more common in women and tend to appear later in life. Factors like previous radiation exposure or hormonal changes may play a role, but they're not things you could control.
I see. Well, thank you for explaining everything, Doctor. It's a lot to take in, but I feel a bit calmer now.
I'm glad to hear that. Remember, you're not alone in this. We'll take things one step at a time. Once we have the MRI results, we can discuss the best course of action together.
Thank you. I appreciate that.
You're welcome. Take care, Mr. Allen, and we'll be in touch soon.
Extract 2. Questions 13 to 24. You hear a doctor talking to a patient called Selena. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
I see that you've booked this appointment to discuss a skin issue. Can you tell me more about it?
Sure. I've been dealing with this rash on my hands and forearms for a couple of months now. At first it was just a bit of redness and itching, but lately it's gotten much worse. Dry, cracked, and sometimes even weeping in places. It's really uncomfortable, and it's starting to affect my work and sleep.
That sounds quite distressing. Can you describe the itching? Is it constant or does it come and go?
It's constant, but it's worse at night. Sometimes I wake up scratching without realizing it. During the day I try to ignore it, but certain things seem to make it worse, like washing my hands or being in a heated room.
I see. And have you noticed any triggers that seem to bring on or worsen the rash? For example, any specific products, foods, or environmental changes?
I've thought about that. I switched to a new dishwashing liquid a while ago, and I feel like it might have started around then. But I'm not entirely sure. I also work in a bakery, so I'm constantly washing my hands and wearing gloves. I think the gloves make it worse, especially when my hands get sweaty inside them.
That makes sense. Latex or other glove materials can sometimes irritate sensitive skin, especially if worn for long periods. Have you tried anything to manage the symptoms?
Yes, I've tried using a regular moisturizer, but it doesn't seem to do much. I also bought a hydrocortisone cream from the pharmacy, which helped a bit with the itching, but the dryness and cracking didn't go away.
Thank you for sharing that. Let's take a step back. Have you ever had any skin conditions like this before, or does anyone in your family have similar issues?
I had eczema as a child, but it wasn't this bad, and it mostly went away by the time I was a teenager. My younger brother has it too, but his is milder.
Okay. And other than the itching and cracking, have you noticed anything else, like swelling, oozing, or fever?
Sometimes there's a clear fluid coming from the cracks, especially when I scratch too much, but no fever or swelling.
Thanks, Selena. I'd like to ask about your overall health. Do you have any other medical conditions or take any medications regularly?
No, I'm generally healthy and don't take any medications.
That's good to hear. One more thing, how is this affecting your daily life? You mentioned work earlier.
It's frustrating because I work with food, so I wash my hands constantly, which makes them even drier. At night, the itching keeps me awake, and during the day, the cracks make simple things like holding utensils or opening jars really painful.
I can see how this would significantly impact your routine. What I'd like to do now is examine the affected areas. After that, we'll talk about how to manage this and get your skin back to a healthier state.
That sounds good. I just want to stop the itching and heal these cracks.
Of course. After the examination, we'll discuss some options. From what you've told me so far, this does sound like a flare-up of eczema, likely aggravated by irritants like frequent hand washing and the gloves you wear. But let me confirm that during the exam.
Thanks. I was worried it might be something else.
Eczema is a common condition, and there are effective ways to manage it. Treatment will likely involve a stronger prescription emollient to hydrate and protect your skin, a topical corticosteroid to reduce inflammation during flare-ups, recommendations to avoid triggers like irritants in soaps and gloves.
Would I need to stop wearing gloves at work?
Not necessarily, but we'll look into alternatives. For instance, wearing cotton gloves under the latex ones can help reduce irritation. We'll also discuss other changes to your routine, like switching to fragrance-free hand soaps and using protective creams.
That makes sense. Will I always have this, though?
Eczema tends to come and go, and while it may not disappear completely, managing triggers and using the right treatments can keep flare-ups under control. Regular care will help strengthen your skin barrier over time.
I see. Thanks for explaining.
You're welcome. After the examination, we'll finalize a treatment plan and schedule a follow-up to monitor your progress. If anything changes or worsens, let me know right away.
Will do. Thanks, Doctor.
My pleasure. Let's get started with the exam.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 radiologists discussing the screening method for a high-risk lung cancer patient. Now, read the question.
I've just reviewed a case of a 65-year-old male with a 40-pack-year smoking history. He's considered high risk for lung cancer, and the clinic is asking whether we should recommend a low-dose CT scan or a traditional chest X-ray for screening.
What are your thoughts on that?
I'm inclined to recommend the low-dose CT scan because it has a higher sensitivity for detecting early-stage lung cancer.
Is there any downside to using low-dose CT over a chest X-ray?
There's a slightly higher chance of false positives, but the benefits of early detection outweigh that. Plus, the radiation dose with low-dose CT is still minimal compared to traditional CT scans.
I see. So the low-dose CT balances accuracy with acceptable risks?
Exactly. If we detect an abnormality, follow-up imaging or biopsy can confirm the diagnosis.
Okay, that seems reasonable. Let's go with the low-dose CT for this patient and notify the clinic.
Now look at question 26. You hear a researcher speaking to a colleague about their efforts in translational research. Now, read the question.
We're in the process of refining the drug formulation to ensure safety for clinical trials.
I see. Did you encounter any challenges while adapting it for humans?
Definitely. The dosage range is tricky. Animals and humans metabolize it differently, so we're adjusting based on toxicity data from preclinical studies.
And once that's ready, you will apply for human trials?
Exactly. The regulatory approvals are already underway. If all goes well, we'll be able to move to phase 1 trials in a few months.
Exciting. Translating preclinical success to patients is always the most rewarding part.
Absolutely. This work could be a game changer for so many.
Now look at question 27. You hear a doctor briefing a colleague about a patient before their next appointment. Now read the question.
Okay, so the next thing is about Mr. Jameson in consultation room 2.
Right.
He's here today to follow up on his diabetes management. His last HbA1c was 9%, which is still above target. I've had multiple conversations with him about improving his diet and exercise routine, but he seems reluctant to make meaningful changes. I've explained that he may need to start on insulin if things don't improve. For now, I've adjusted his metformin dose to 1,000 milligrams twice daily and added sitagliptin once daily. He also needs a repeat HbA1c test in 3 months to assess progress. The priority today is to emphasize how important it is for him to commit to lifestyle changes and take his medication as prescribed. Can you focus on addressing his concerns and motivating him to stick to the plan?
Got it.
Now look at question 28. You hear a physiotherapist discussing with a patient. Now read the question. So today, we are going to discuss your recovery process after the hip replacement surgery and work out a plan to help you regain strength and independence. How have you been managing so far?
It's been challenging. I've started walking short distances with a walker, but it feels exhausting. I want to feel stronger so I can move around more freely at home.
What are the main challenges you're experiencing right now?
The biggest issue is getting out of bed in the mornings. It takes so much effort, and I feel weak and unsteady. I'm also nervous about trying to sit down and stand up from a chair without assistance. It's frustrating not being able to do these things independently.
Now look at question 29. You hear a medical professional explaining about antibiotics prescription. Now read the question.
Due to a significant increase in cases where antibiotics are being prescribed unnecessarily or inappropriately, we wanted to revisit our antibiotic stewardship program. I know some of you have recently completed training on this, but it is always valuable to reinforce key principles. The first step is to ensure that antibiotics are prescribed only when clinically indicated based on evidence and guidelines. This includes avoiding antibiotics for viral infections and ensuring cultures and sensitivities are checked before initiating therapy. Next, we must monitor the appropriate duration of therapy. Overuse or prolonged use of antibiotics can lead to resistance and other adverse effects. Please review our hospital's antibiotic usage protocols after this meeting to familiarize yourself with the recommended durations. Additionally, remember the importance of collaboration with our pharmacy team and infectious disease specialists. They are invaluable in guiding the most effective and targeted antibiotic use for our patients. Finally, we must educate patients about the risks of antibiotic misuse and the importance of completing prescribed courses. These efforts collectively support patient safety and reduce the threat of antibiotic resistance. Are there any questions?
Now look at question 30. You hear part of a surgical team's briefing. Now read the question.
cardiac bypass surgery. Are there any specific concerns from an anesthesia standpoint?
His cardiovascular health is stable, but he has a history of controlled hypertension. No other major issues aside from a slightly elevated BMI of 32.
Do we need to consider additional monitoring for hypertension during the procedure?
Standard monitoring should suffice. We'll adjust as needed if his blood pressure fluctuates.
And for his postoperative pain management, what's the plan?
He's on a low dose of beta blockers, so we'll need to avoid medications that may cause significant drops in blood pressure. A nerve block might help with pain control without impacting his hemodynamics.
That sounds reasonable. We'll also ensure he has clear instructions about medication resumption post-surgery.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview about leadership and advocacy in healthcare. You now have 90 seconds to read questions.
Hello everyone. Today I am joined by Dr. Maria Hall, a renowned occupational therapist and policy advisor, who has dedicated her career to leadership and advocacy in healthcare. Thank you for being here today, Dr. Hall.
Thank you, James. I'm excited to discuss a topic that's becoming increasingly relevant in healthcare today: how leadership and advocacy play a vital role in shaping better practices and outcomes.
That sounds fascinating. Could you start by explaining why leadership and advocacy have become so important for healthcare professionals?
Certainly. Healthcare is a rapidly changing field, influenced by technology, policy shifts, and population needs. For occupational therapists and other professionals, it's no longer enough to focus solely on individual client care. We're realizing that our problem-solving skills and holistic thinking can have a broader impact. By stepping into leadership roles and advocating at a systems level, we can address challenges like inequitable access to services, outdated policies, and workforce shortages.
That's very insightful. Could you give an example of how occupational therapists have been able to lead or advocate effectively in healthcare?
Of course. One example is the work being done around mental health awareness. Occupational therapists have used their expertise in understanding daily activities and routines to influence policy. By collaborating with government bodies, they've been instrumental in shaping programs that integrate mental health services into community settings. This not only improves accessibility, but also reduces the stigma around seeking help.
That's a great example. What specific skills do you think healthcare professionals need to develop to be effective leaders and advocates?
Key skills include communication, strategic thinking, and collaboration. Professionals need to articulate their vision clearly, think long-term, and build partnerships across different sectors. Importantly, they also need a strong understanding of policy and how to navigate complex healthcare systems. For occupational therapists, their ability to look at the big picture while focusing on individual needs makes them particularly well suited for leadership roles. How does the College of Occupational Therapists support professionals in developing these skills? The college plays a pivotal role by offering specialized training and mentorship programs. For example, they've launched a leadership development initiative that includes workshops on advocacy, public speaking, and policy engagement. They also encourage therapists to participate in professional networks, where they can learn from peers and experienced leaders.
How do you think advocacy and leadership ultimately impact healthcare systems?
Advocacy and leadership drive systemic change. When professionals advocate for better practices, they contribute to policies that improve patient outcomes, enhance workforce well-being, and ensure resource efficiency. For instance, advocating for the inclusion of occupational therapy in primary care has shown to reduce hospital readmissions and improve patients' quality of life. It's about creating sustainable healthcare systems that serve everyone effectively.
Finally, what advice would you give to professionals who want to start advocating or taking on leadership roles?
Start small but think big. Begin by identifying an issue you're passionate about, whether it's improving access to care or promoting a specific therapy approach. Get involved in your professional association, attend conferences, and network with like-minded individuals. Building credibility through continuous professional development and staying informed about current trends is crucial. Remember, every small step you take contributes to meaningful change.
That's excellent advice. Thank you, Dr. Hall, for sharing your insights.
Thank you, James. It's been a pleasure.
Extract 2. Questions 37 to 42. You hear a presentation by Dr. Rio George discussing artificial intelligence in radiology. Now, read the questions. You now have 90 seconds to read questions.
Good afternoon, everyone. My name is Dr. Rio George, and today I'll be discussing a topic shaping the future of healthcare: artificial intelligence in radiology. In recent years, the integration of AI into radiology has revolutionized our approach to imaging, diagnosis, and patient care. AI is no longer just a buzzword. It has become an indispensable tool for radiologists and the broader healthcare system. Let's begin with the core of this transformation: efficiency. Radiology has always been a high-pressure specialty due to the sheer volume of images we handle daily. AI is helping us by automating routine tasks, such as image sorting and preliminary analysis, which allows radiologists to focus on more complex cases. For example, an AI algorithm can now flag potentially cancerous lesions in mammograms, significantly reducing the workload for human reviewers and improving detection rates. Another exciting aspect is AI's role in enhancing diagnostic accuracy. Traditional imaging techniques depend heavily on the expertise of radiologists. While our training and experience allow us to interpret images effectively, there's always room for error. AI systems trained on vast datasets can identify patterns and subtle anomalies that may not be immediately apparent to the human eye. For instance, AI has proven especially valuable in detecting early signs of diseases like lung cancer and Alzheimer's. AI also promises to transform imaging workflows. Take MRI scans, for example. These scans can be time-consuming, taking anywhere from 30 minutes to over an hour, which limits throughput and patient satisfaction. AI algorithms are now capable of reconstructing high-quality images from significantly less raw data, reducing scan times and enabling faster diagnoses. The implications for patient care are immense, particularly in emergency settings where every second counts. One of the most significant shifts is the role radiologists play in patient care. As AI takes over repetitive and labor-intensive tasks, radiologists are increasingly stepping into more collaborative and patient-facing roles. We're becoming key members of multidisciplinary teams, guiding clinicians on imaging strategies and communicating results directly to patients. This shift not only humanizes our profession, but also enhances patient satisfaction and trust. Let's not overlook the challenges. The rise of AI in radiology has sparked concerns about job security among radiologists. Will AI replace us? The answer, I firmly believe, is no. Instead, AI is redefining what it means to be a radiologist. By automating mundane tasks, it frees us to focus on what we do best, making clinical decisions and interacting with patients. In fact, radiologists who embrace AI will likely find their roles expanding, not diminishing. Lastly, we must consider the ethical implications. AI systems are only as good as the data they're trained on. If the training data is biased, the AI's outputs will also be biased. For example, an AI system trained primarily on images from one demographic may struggle to perform accurately across diverse patient populations. Ensuring equity in AI applications is a challenge we must address to harness its full potential responsibly. In conclusion, artificial intelligence is not here to replace radiologists, but to empower us. By enhancing efficiency, accuracy, and patient engagement, AI is transforming radiology into a more dynamic and impactful specialty. But as with any powerful tool, it's up to us to use it wisely, ensuring it benefits all patients equitably. Thank you, and I look forward to your questions.
That is the end of Part C. You now have 2 minutes to check your answers.